Hello, everyone. This is Mr. Poe. He is struggling with urinary blockage issue like most of his life, which we heard was a pretty common problem for male cats. So after an initial issue when he was a kitten, we hadn't had any for years after, but over the last few months, he started to have it again. So his doctor recommended this PU surgery. So we decided to go ahead and chronicle his post-surgery recovery. Here he is. We are in the car ready to go home, and the surgery went well. Okay, we are back at the house, and he is in an own separate room right now recovering. He is super loopy from the medication and pacing back and forth. We're just trying to keep him comfortable. We're trying to keep him down off of jumping anything so he doesn't hurt himself because he is on such heavy pain meds, and we do have 3 other cats. So hopefully he'll just rest tonight. He ate some kibble, and we fed him some wet food with water just to make sure he stays hydrated. The wound is red, and there is some blood that leaks along with some urination, and the medication should last about 3 days as it is time release. So we hope to keep him in this room by himself while his medication wears off. We were going to keep him in a bathroom, but the doctor said as long as he's comfortable, that's the most important thing. So he can heal and doesn't get stressed out or anything during this process. We also had 2 types of litter recommended, the shredded paper and the pellets. But again, the doctor said if he's not using that, go ahead and switch it up for his regular sand litter just to make sure that he goes, because that's the most important thing, is that he continues to urinate, especially after the surgery. Day 2 is going well, still loopy, and he woke me up at like 3 a.m. crying, and so I fed him. We cleaned up the room. He also peed easily and poop, so that was great to see. There is still some small blood drops, but that's to be expected after surgery. There is some food and litter spilt because he is so loopy and he's accidentally like hitting them with his cone. I realized that layering the floors with dog pee pads and then 2 layers of sheets was perfect, so I can easily roll up each layer of sheet and reveal a nice clean surface pretty quickly for the first 3 days while he was still on the heavy medication. I highly recommend layering the floor. It definitely got dirty quickly, and it was really nice to be able to just quickly bring up the next layer. I also got disposable low lid clearance litters, and I placed them around the house and the room so he can easily get in and out with his cone on. We also got like these high dishes that he could wrap his cone around and eat and drink without me having to hold it each time. However, the first 3 days I definitely held it for him. He wanted to walk around the house, so we let him, but we did place some blankets and pee pads all around the rugs that we had in case he still had some leaking from his wound. Day 4, he is definitely wanting to be out with everybody and walk around. The loopy medication has worn off, and now he's just on anti-inflammatory pills. We have a checkup in 3 days, and so far everything seems to be going really well. We just got back from his week 1 follow-up. The doctor says everything looks good. He is peeing and pooping just fine and eating really well. Mostly he's just sleeping and laying around. I'm sure he doesn't feel that great, but his wound looks good. I mean, it looks bad, but it's the healing process, so it looks good according to where he should be at in his healing process. We just got back from his week 2 follow-up, and the doctor said, again, it was still looking good, but we were hoping to get the cone off or the okay to take the cone off, but she said there needs to be 1 more week of healing. But again, everything looked good. He's still doing really well. He doesn't seem to be in much pain, if at all. We do take the cone off for a few minutes, but it's highly supervised. This is just to kind of give him a chance to clean around his mouth and his little paws. But he's a really good boy, and he doesn't even try to get to the wound. Okay, it's the end of week 3, and we just saw the doctor, and she gave us the okay to take the cone off. This is a big relief for him and for us. We can now dish the disposable litters he used while he had his cone on, and now he can go back to his regular litters with the higher sides and his regular bowls for food and water and get back to playing. We are super happy we did this, and I think he is too. His urine streams are no longer strained, and he seems to be happier overall. Okay, so that has been Mr. Poe's PU surgery recovery. Hope you enjoyed. Hope you got some information from it. Thanks for watching.